costs in our healthcare system and make sure we can provide quality, affordable healthcare to every American. I know all of the doubts and all the concerns about this, but let me just lay it out for you briefly. We spend more money than anybody in the world by 50%. I think the next highest spending country is Switzerland. But the big difference between us and these other countries is they have health insurance for everybody. Everybody's covered, and they actually bring the cost down because once everybody's in the system, then everybody gets access to preventive care, and they don't show up in the emergency room and they're much sicker than they would have been otherwise. So I've been giving a lot of thought to this, as you might expect, because for more than 15 years, I have worked to try to figure out how can we solve this problem? Why should we be spending more money than anybody? The price for everybody keeps going up higher and higher. We have 47 million people without insurance, and we have probably another 40 million who have insurance, except it won't pay for what your doctors and your hospitals tell you you're supposed to have, right? It is so maddening to people. I spent a lot of time as a senator trying to fight with insurance companies because so many of my constituents come to me and they say, I don't know what I've done wrong. A man came to me from northern New York. He'd worked for the same company. He'd always had the same insurance policy. His family had been healthy. He paid his premiums. He did everything he was supposed to do. And his son was diagnosed with a serious illness. The doctors all said, this is such a rare illness. There's only one place in the country that really knows how to treat it. So the man called his insurance company and said he needed to go to this hospital and have the operation that was necessary. The insurance company said, well, we won't pay for it. And the man said, well, wait a minute, I've paid my premiums, I've been a good customer, we won't pay for it. So he called me and I got involved, and I argued with him and my staff argued with him, and I think to avoid bad publicity, to be honest with you, they said, okay, fine, we'll pay for it. But I gotta tell you, I don't think it should take a United States Senator to get a father to be able to get the health care. If you have health insurance and you're happy with it, nothing changes. You keep what you have. We don't want anybody to be disrupted, because if you're satisfied, that takes care of it. But if you don't have health insurance, or you have the kind of insurance that won't pay for what you need, or even many of you have it where they say, okay, you're a diabetic, well, we won't cover you for your diabetes. It's called a pre-existing condition, and they do everything they possibly can to call everything a pre-existing condition so they don't have to pay for it. If you're in that boat, we're going to open up for you the plan that members of Congress have. Congress has a good health care plan. There are more than 250 options to choose from, and these are good plans. They cover prevention. They cover mental health, something that we should cover in America. Say, okay, you can buy into it now. It's cheaper because there are millions of people in it. It's like when you go to a big discount store. If you buy a carton of toilet paper, each roll is less expensive than if you buy one. Well, if you have many millions of people in the healthcare plan, you can get lower prices. If you have problems affording it, we're going to provide healthcare tax credits, and we're going to limit the amount of money that anybody has to pay to a small percentage of your income for your health care premium. All those many millions of people are in the system, that's why you can get the price down. And this is a big difference between my opponent and myself, because I know that if we don't have health care coverage that everybody is involved in, then people with health insurance are still going to continue to pay a hidden tax for everybody who doesn't have it, but who gets it at the last minute in the emergency room. And at some point, that is a losing proposition. And I know, there'll be people who say, oh my gosh, that sounds like government-run health care. And I've been saying, well, ask your Republican member of Congress if what he has is government-run health care. 250 private health insurance plans to choose from, and there'll be many more once we get everybody into it. And I believe that this is the best way, because it's a pre-existing system. We're not changing anything. We're just opening it up to everybody. We're also going to continue to do do everything we can to make sure education remains a passport to opportunity. Because right now, too many young people are not well prepared to go to school. We need to do more working with families.